it's going to be hell for whoever's stepping in, because I've maintained this behavior for so long. It's worked for me. I've been able to get what I want. So why am I changing? You have the problem, not me. From the child's perspective.
Hello, and welcome to another episode of the Stop Sulking podcast, a safe space for women that prioritize their health, their self-love, and their goals. My name is Miss Tasha Talks Life, and I guide you to your dream life faster, to those same things: your health, your mindset, your self-love, and your goals. And today we have a guest, a new friend that we are meeting together. Miss Desirie Sykes, and before we get right into it, we're gonna allow you to introduce yourself. Welcome to the show.
Welcome. Thank you so much for having me. I'm really excited to be here and to dive into all things mental health and special education, if we can.
Yeah. No, this is great. So we're talking about mental health, and there is so many layers. There is so much to it, right? There is so tell us a little bit about your lane and exactly what you do.
So I am the founder and owner of Ness Behavior Consulting. It is a behavioral health agency, and we pretty much provide therapy for children who have a primary diagnosis of autism. And families come to us, whether it's through their insurance, and sometimes they come to us through the school district as well. So we have insurance funders and school district funders. If you come through the district, it's kind of, not only you don't have to have autism, you can have any behavior that's impeding on your ability to learn and requires a behavior consultant or some sort of special education support. So that's usually outlined in a child's IEP. Their individual educational plan will pretty much let the parents know you need behavior support, whether that's parent training, one-on-one with the child in school, or after school extended day services. So that's how we come in. So that's what I do as far as, providing therapy to children. And outside of that, what makes us so unique is that not only do I want to look at, and I train my team to look at the child and providing support for the child, we also look at the family as a whole and what they need, and really not providing this cookie cutter approach of therapy services, but being personable, being allowing ourselves to be vulnerable and really attach ourselves to the families that we are providing services to.
I love that. So if a parent is if receiving your services, it's because their child is already a part of your program or your.
Yeah, so they either find us. Sometimes you can call your insurance company and you're asking for therapy. Our therapy is called ABA therapy. That stands for Applied Behavior Analysis. It's the therapy specifically approved through our insurance for children who have autism diagnosis. So if you have a primary autism diagnosis, you can ask your insurance provider for an ABA provider, and sometimes they point. If you're living in the local area where we're servicing Nassau County, Suffolk County, Brooklyn, Bronx, and Queens, we would be on that list. And then we have contracts with school districts in Long Island, Nassau County, and Suffolk County. So if they see us fit for the particular job, they would also call us and introduce us to a student who's in need of services. And from there, the relationship begins with our families.
Got it. So then at that point, you offer these extra services to the parents.
Yes.
Okay. Mm-hmm. And the reason why I'm asking is because those that know me, that you've been here for a long time. If not, you're gonna find out today. I am a retired teacher from the classroom, specialized in general ed and special education, and so I am very familiar with like IEPs and all of that on the education teacher side. And then I transitioned to, outside of working Tasha Talks Life LLC, and I started doing educational consulting as well for students with autism. So I'm learning the outside of, on the other side of it. And honestly, I feel like it's such a need, what you're doing and what you're offering the families, because even with myself, I have 2 cases, and the parents, they just don't know. And and I'm grateful that I do have the knowledge that I do. I'm not by any means like special, but I've been in it for 14 years where I can at least help, it gives some type of tips. And then I'm a researcher and, so, but,
yes.
but to actually have that included, if you will, I think it's so important. I think it's so necessary. So kudos to you for that. I love it. I love it. So tell me just a little bit, because I'm like a story girl and I like to know like how stuff starts. And like, so tell me a little bit about how Ness Care, did I say that correctly? Ness Care came about.
Okay, so Ness Cares is the nonprofit that gives us all this extra stuff. So Ness Behavior Consulting was launched in 2018. So 2018, 2019, I'm building. I'm figuring out, okay, how do I get these contracts? What do I need to do? And prior to that, I started out as a behavior consultant. So I was the girl walking into your classroom and asking you what child you needed assistance with. Now, as a behavior consultant, we focus on classroom management, right? Working with the special education teacher to establish management as a whole. But then you have these one or two students who the classroom management approach is not working. So then we single them out to provide like FBAs, functional behavior assessments, or behavior plans if needed. So that's what I did. And I was really good at my job. The last particular job I had, they called me in to develop a whole special education classroom. So really from the ground up, and it was so intense. And from that experience, I learned a lot about what happens in the classroom and what happens outside the classroom, what happens behind those closed doors in those meetings. And what was very consistent to me was that parents had absolutely no idea how important their role was in their children's education. They were not asking the right questions, and they were not following up properly. And it just left so much control on the school system, which, yes, I believe that our special education system, in our schools, teachers they do the best that they can. But at the end of the day, it's a business, right? And sometimes, in my opinion, our kids don't belong in the special education classroom in the public school system. They need to be placed somewhere else. But how do we get to that conversation? So I was very limited with getting to that conversation because of the way that I was contracted into these schools. So I playfully, I told my supervisor, I want to start my own business and do it differently. And she said, go ahead. She told me, go ahead. I don't know if she thought I was serious at the time, but I really was. And she gave me all of her credentials and I figured it out. So in 2018, 2019, I'm setting the groundwork, and then COVID happened. So when COVID happened, I was like, okay, well, can't do anything now. So the schools were closed, everything was shut down. But what stuck out to me was I asked myself a question. So are you going to hang it up, or are we going to quit? And I kept going because our children still existed. They were still in need. It was just a new dynamic. And that's how the nonprofit Ness Cares came about. So with Ness Cares, we started to give out sensory boxes to children some of my old clients, just filled with face masks, hand sanitizers, COVID essentials, and sensory toys. Our kids were so happy to get those things in the mail that we started sending them out every season. And from there, it just grew. Like now we have 3 programs under Ness Cares where we continue to send out the sensory boxes, which has revamped to sensory bags. We have a copay program where we have a fund where we're trying to reach $100,000 so that we can provide grants for families to cover their copay expenses for behavioral and mental health needs. And we're trying to develop a therapeutic home where children can go and treat the family as a whole and get all the therapy that they need in one place. And we want a home setting because it's unique and it's real life. We want to mimic real life. Like, what are you going to do outside of the classroom? What are you going to do outside of the therapeutic office? So that's our way of looking at the family as a home.
Oh my God. Like I'm sitting here like calm because I know that I can't get too amped because then I'm going to mess up the audio between you talking. Yeah. But oh my God. Yeah. Like that is amazing.
We're doing a lot of work.
Oh my God. I'm so blown away. And I think that is just not It's so amazing. God bless you.
Thank you.
It's so, and just like I said, being on the other side of it, I see how much like the sensory toys are attractions for them and so necessary to help to get them to, you know, just focus and just transition and just, you know, get to doing and just to calm them, like so many different reasons. And I love that. I absolutely, that's just so dope. I think that that's amazing. So kudos for you, to you for that, Desiree, because,
Thank you.
and I love the in-home aspect, right? Not only, like you said, is it different, but it also gives that, because we already know like students that have special needs sometimes have, when they're in like a new environment, or if something doesn't feel comfortable, or something does, it takes a while for them to warm up. And so it's all amazing. It's all necessary and more. And I think after COVID, a lot of things was uncovered. I think, I think also parents were able to really see what their kids, and this is not just on a special needs part, but just in general, what they knew, what they didn't. I think a lot of parents didn't understand that their students may not be able to read as well, or maybe struggling in certain areas for whatever reason. They could be working 2 jobs. They could be, you know, whatever. They could not be, as I worked in a Title I school district. So it was a lot of low income. It was a lot of, but it also, there was some, you know, some students that were thriving and families that were good and everything like that. But I saw various levels of it. And I think even for myself, like my kids were a little bit younger, but even for myself, I got to see, you know, another side, as even as a teacher, and being home, teaching from home, and then having kids that have to go on too, and, you know, all of that. So I think COVID definitely opened up a lot of people's eyes. It also set us back. Right? It set us back, where it just seems like, and you know, I'm tired of them using the excuse now. I mean, it's been a couple of years, but to have this for those that are in need, that have, you know, because imagine the parents that are home with their students and they have not been diagnosed, or they don't know, and they just like frustrated. And so let's talk to that a little bit about, like, you know, just a parent just dealing, or what are some indicators, or give me, you know, something that we can maybe identify, or just to know, or just, you know.
It's a good thing that you brought that up. Like, that's a good thing, because I think COVID uncovered a lot, and it allowed parents to appreciate like the services that they were getting from school, or the lack, or identify the lack of services. So it forced us to ask questions, right? So the question you're asking me now is, how do you know? Not only how do you know, but really working with parents to accept. Like, there's sometimes it's a cultural barrier. Like, we don't want to talk about my child having any disability, because that's not acceptable in my home, right? Because of who we are, we're proud, or it's my culture, whatever it may be, doesn't take away from the fact that the child is in need. But we have to be sensitive about those conversations, right? And I think as educators, always being in a position to learn how to culturally approach those conversations is extremely important. But what I would say is the child's milestones, right? Having everybody on board. So your pediatrician, having your regular pediatrician visits to ensure that the child is meeting their milestones. When your child is transitioning maybe from pre-K to kindergarten to first grade, those are when you usually start to see a their schedule is disrupted. How are they adjusting to that? So the lack of, you may be getting called a lot from school for behavior. Maybe your child is having temper tantrums, eloping, and we want to punish our kids. Like, why are you calling me? Why is the teacher calling me to come pick you up from school, or whatever the case may be? We got to take our time and really understand what is the functions of those behaviors. Why do you keep running away from your teachers? Why are you throwing temper tantrums in class? And then we get to start to analyze how we're teaching. What's happening before the behavior? What's maintaining those behaviors? And how can we adjust the environment to see a different change in behavior? And really looking at treating the behavior instead of punishing the child, right? So that's a big tip.
Yeah, no, that is. And I think I think that so when you were talking about that, I was thinking about number one, when I was a kid.
Yeah.
So different. Right? Like we listen, okay? We could control everything. And then on the flip side, that like gentle parenting, right?
Right.
And so it's like there is common ground, there is a middle, right?
I
and
agree.
and because I don't know, and this is a sidebar, the gentle parenting thing, like my little ones, they can't even tell you like the last time they got a spanking or anything. But I think gentle parenting is just, I just don't even like the way it sounds. Like it just
I get it though, because it's hard consequences, really what gentle parenting is. It's like you're
yeah,
making the decision for yourself. And I
yes,
used to, as a parent too, sometimes I ask myself, how am I in this field when I have a short fuse with my kids sometimes, because why are you doing that? But what I've learned professionally and as a mom is giving your kids consequences is so important because it takes you out of it instead of, oh, I'm going to get in trouble because my mom, or because she's going to be angry. I'm not angry. You didn't do X, so that's why this is happening. So if you don't
yeah,
want this to happen, you are responsible for making another choice and
yeah,
really giving that back to them in any situation. And it's a life skill. So
it is.
as an adult, if I don't go to work, I'm not getting paid. So I can't be mad when payday come around and I don't get paid because I chose not to go to work.
Exactly. No, it's so funny because my oldest son, he's 21, and we literally grew up together. So a lot of the things that he sees, he's like, that could never happen to me, and I'm like, whatever. But as an educator, my patience has increased with my own kids, right? Just knowing like if I can't spank little JoJo, you know what I'm saying?
Right.
I don't have to I can use the same strategies and the same thing, and I just laugh about when I say gentle parenting, because the way they make it seem is like, it's like you're soft and you let the kids get
Right,
away with
exactly.
everything, right? So I don't use that term, but I actually have conversations. My kids, they have a voice, they're allowed to express, but they just know that they can't, it has to be with respect,
Right.
right? And then I like you said, with the consequences, what do you think? Not saying that it's gonna be, but I just want you to think about what, and then you have one, because kids are so different. One,
Right.
just on the thought of it, he starts crying. The other one is like,
I know.
you're like, wait a minute.
And it's so important to have your kids be expressive. Like, I know for me growing up, like I come from a West Indian family. So you're gonna do what mommy and daddy told you to do, right? There's not a lot of room for expressing. So my last 2 years of high school, I actually moved to Massachusetts with my sister, and the culture of the school that I was in, I went to Newton South High School in Massachusetts. It was totally different. Like I was in a classroom with students who were going back and forth with the teacher and really being opinionated. And it was crazy to me. I was like, teacher told you to do X and you got a whole philosophy why we need to do A. And
Yeah.
the teacher listened. That was new. But I had to play catch up. I had to play catch up because not only yes, it was a culture shock, but it was a life skill that I needed. So how are you going to negotiate contracts if somebody tells you no and it's no, turn that no into a yes, and this is how you're going to do it, right?
Yes.
So, and they're learning that, kids are learning that from a young age. So I think that yes, I agree with you. I hate the word gentle parenting, but assertive parenting is important, and allowing our kids to have a voice.
Yes, for sure.
Seriously, is important.
Advocate for yourself. I tell my kids all the time, like, you're your first advocate, and then I will advocate for you no matter what. But if I'm not there, you are your first advocate. If somebody's messing up your name, you can tell them how to say your name politely without adult, kid, whoever, correct them on how to say your name.
Right.
Just anything in that sense. And if you feel like it's okay, like, just know I will support you as long as you're
Right.
respectful and whatever. I'm gonna support you, and you're not gonna get, whatever. But yeah, I think it's very important, and I see a difference. I see a difference, and that's why I feel like, honestly, that there is hope, right? There is hope. There was a gap where it was like these kids, like my son's the 21-year-olds now. It was almost like everything was I'm depressed, I'm stressed out, or I can't do this, and this is the end of the world, and it's like, wait, what? You could have never been raised in the 80s. Like, what?
You don't want to spoil them. You want to give them responsibility. I get it. And I think being a parent by yourself is hard. Like when I'm in my professional bubble, I know exactly what I'm doing, right? People can come to me for insight or leadership and I can execute. But then with my own kids, I struggle. Like my son was diagnosed with ADHD and from really young. And even though he was diagnosed with ADHD, I still had certain expectations. So I had to really reel back and follow a plan. Like, listen, like I'm the one creating plans for others. And now here I am having to tell myself, follow somebody else's plan, you know? So
Mm-hmm.
that experience gave me a first row seat to understand when I create a plan for another student, you know, in my work life, how important it is to get mom on board. Not only to read her the plan and let her, you know, understand it, but really understand how it's going to look in your home. What I
Yeah.
need you to do to execute outside of the classroom. So when the child comes back tomorrow, mom and teacher are on the same page, right?
Yeah.
And that's really going to show a change in behavior when they know that what's happening outside of the classroom is going to be followed up at home, and mom and teacher are communicating and executing. That's that's powerful. You know, but and then I had to do that as a mom. Like I had to follow through. I had to step back and allow consequences for behavior or just space to learn, space to make mistakes. I had to learn that. Then I
Yeah.
have a daughter who has, you know, her struggle. She suffers with social anxiety and anxiety, and that's a new thing for me. So
Mm-hmm.
I know what it looks like professionally with the child who I'm working with for 1 to 2 hours, and then I'm out. But now I'm living with it. So what does that look like? And you know, making sure that she has the resources that she needs. So that's another thing, not being ashamed to talk about those things, not being ashamed to go and get help, and putting your kids in therapy is not a bad thing. You know,
Right.
we say like, oh, I don't, you know, you don't want to put your kid in therapy because it might look like the parent is doing something wrong. But honestly, like there are some things that your kids are going to need outside of you. um and not being ashamed of that, really
Yeah,
allowing people who and sort them out. Like just don't just get any therapist,
for
vet them.
sure. No, I think that's important. I think that
Yeah,
I think there I'm an advocate for it. I even if it's not specific to like sometimes like you got to date around. Like
right.
that's how I explain it to people.
Yes.
You have to go on if it doesn't feel right, you have to use your, whatever, and then you switch off and as many
Hmm.
times as you need until you find the good fit. So,
Hmm.
but my question is like as a parent, like you talked about earlier, how parents sometimes they're in denial about the
Right.
needs of their students or their kids or whatever. And now they got this diagnosis and now they don't know
Mm-hmm.
how receptive or not initially are the parents when you're coming to them with, okay, I can help you, I have some what is it called, parent
Training.
training. And
Hmm.
how receptive are they?
Well, by the time they get to me, they've accepted it. So when by the time they get to me, they're asking for services or it's been offered to them in school. So prior to that, what we want to do is, under the Nest Cares umbrella, is create those support groups. So, and walking parents through understanding their IEPs. But what I would say to every family that's newly diagnosed is it's a good thing to be diagnosed early on. It's a sad thing to be diagnosed early on and you're doing a disservice to your child not getting the help that they need. Now I know for a lot of families too, we don't want to be labeled. We don't want that label to walk with us. But we have to also change our perspective. Let that diagnosis work for you. So with a diagnosis, there are a lot of resources that you now have access to that you didn't have access to without that. With the diagnosis, you can go to your school, you can get something called a 504 plan, depending on the diagnosis. That plan will give your child additional resources, whether they're testing, maybe they need breaks during class. My son needed breaks and it worked for him. Maybe they need to sit in the front because they're distracted. That's nothing. Those are little things that you can implement now that you have this diagnosis that is going to make a life-changing effect on, have a life-changing result in their school life.
Mhm.
um or you get an IEP, right? For more severe diagnosis, you have an IEP. These are legally binding documents between the school and the parent, what the school is saying that we have to service you, the services that we have to provide to the family, and hold them to it. Get your services and fight for
Mhm.
your services. And with that diagnosis, you now can have a conversation and get additional services covered through your insurance. Get everything. So
Right.
instead of paying out of pocket, or, having to go to therapies that are sometimes misleading, you have access now because of this diagnosis to ask certain questions, to vet certain people. And it's not a negative thing. The negative thing is you get this diagnosis, you do nothing, and the child suffers. And now the child is 15, 16, 17 years old, and those behaviors have now been maintained for all those years. So another thing about behavior, and it's not the person that we are treating, it's the behavior. So if the child has learned for 10 plus years that if I engage in problem behavior, I'm going to get access to what I want, right? And that could be anything. That can be tantrums that then turn into physical aggression, that then turns into getting kicked out of school and I'm fighting mom, right? If I've learned that over years and years and years because I never got the help I needed, by the time I'm in high school and mom is trying to get me help, it's going to be hell for whoever's stepping in, because I've maintained this behavior for so long. It's worked for me. I've been able to get what I want. So why am I changing? You have
Right.
the problem, not me.
Right.
From the child's perspective. So we also have to be very careful about that too. And it's a hard decision to make. It's a hard thing to accept when you get a new diagnosis, and that's why, again, treating the family as a whole, taking care of, mom and dad's mental capacity, making sure that they are full in order to execute the needs of the child.
Yeah. So I have two questions because
Yeah.
this is so good. This is so good. So I have two questions. My first question, so I don't forget my second question. My first question is, if we even back up a little bit further, like, because as an educator that's been in the field and stuff like that, sometimes you can see, like, from little kids in your family or people that you encounter, you can see maybe like the lack of eye contact, or you can see certain things, and you would never, right, feel like do you,
Right.
but that's the thing, like, not for me, it's not for me to say, but if a person is in denial, right, and they may be something there or not, but in the beginning, what would that look like for, see, I guess because I'm educated, I'm always like not comparing in a way of my other kid did this and my other kid, but just knowing what I know about development and things like that. You could say, all right, my baby was 5 weeks early, premature. I'm going to get him that special, I forget what it's called, that's my tongue right now, where they do an evaluation, 5 months, 10 months, and they do it until they say, okay, he's good to go. He's meeting his milestones, like that. But like, if you're just a person that's literally in denial, not of your own, what do you, or how would someone else maybe support them, or is that even a thing?
So educators are really important, because as a teacher, you have our kids. Our teachers, you have our kids for most of the day. So teacher recommendations are so important. They get the parent to start asking questions if they're not, and then going to their pediatrician. The pediatrician is also key because they're writing the diagnosis.
Yeah. Even earlier than that, though, like, because I know what you're saying about in the school, for sure, like kindergarten, first grade, second, the teacher definitely would be like, okay, because they got 20 to 30 kids coming through. So they'd be like, okay, we have this, we recommend. And schools don't like you to say anything about going to the special ed department and asking for an assessment. But we can say, you could go to the pediatrician and see, whatever. But like earlier than that, because if you can catch it pre-K, right, then that is a good start also. So is there an answer to that?
Yes, but it's difficult. See, pre-K, earlier than that, early intervention is like for more severe behavior. So your pediatrician is going to catch it if it's severe, right? So mom and dad is going to see it if it's severe. It's in your face. But sometimes at an early age, when it's not severe, your doctor doesn't even want to diagnose, because we're not even giving the child a chance to grow, right? So my daughter had a very late speech. She had a speech delay. She didn't start speaking until maybe 4. And now she can't stop talking, So we don't want to cripple our kids when they're growing. So that's why it's important for everyone to be on board. Your family shouldn't be ashamed to talk to you, or feel hesitant to talk to you, because it starts in the home. Your doctor, your educators, And family, that's where the child is going to be first exposed. You have to pay attention. So if the doctor misses it, if mom and dad misses it, your educator is going to see it. So pre-K, kindergarten, first grade is where the teachers are really looking at those milestones. So again, when I was telling you in the beginning, parents are not asking the right questions. So if you're waiting for the teacher to say something to you, and they happen to, then great. Maybe you're not aware, but walk in asking those questions. Walk in knowing those milestones, and you should know those milestones because if you're taking your child to regular pediatrics visits, they're taking track of that anyway. But in school is where we start to see the social skills, where we see the lack of eye contact. Are they initiating play with others? Can they sit independently? Are they able to take turns appropriately? What does bathroom skills look like? Are we going to the bathroom regularly? Are we wetting ourselves? At an inappropriate age. How are we learning? So those things are outside of PED's office. That's the classroom. That's our world. So I would say educators are really important. Before that, it's the family unit as a whole.
Yeah, and the other question, it'll come back to me, but I also know from my experience with other educators, and this may not be everywhere, but sometimes it appears that the students that may be struggling, right, and that may be struggling, they may have a disability, but because they're struggling, they're more on them. Meaning, you can have a student that is very bright and displays some of those same behaviors, but because they're not failing, or because it's not a concern or a flag. And that for me was a problem, right? Because I feel like, even if sometimes students just misbehave because they don't understand and they don't want to do it. So it doesn't mean that they need special ed or whatever, right? But because this student is not, may not be reading on grade level and is acting out, or not, doesn't want to do the work. Now it's like, oh, maybe there's something else going on, whereas you can have another student who is doing the work, can do the work, jumping around, and you call on them and they know exactly where you are. But there still may be some ADD or something else going on, but because they are on par with what's going on, it's not a thing. And I don't know. What's your take on that?
So there's two approaches. So the school is focused on education. When you get services through your insurance, they're focused on medical. So education, a lot of our kids who are higher functioning, like you described, they get A's, but they are like academically strong, but behaviorally we need some help. I see a lot of times that those kids have a harder time obtaining services because we can't find an educational need. The school can't find what's objectively, why are we providing these services if we're getting A's? It's a parenting thing. You have to discipline your child, right? So now it's on the parent to see what is there something medically, like granted, sometimes our kids do need some hard disciplining. That's straight what it is. Maybe it is there is something happening at home. Like, for example, you might be going through a divorce and you may think that your kids don't notice what's happening. They're well behaved at home, but they're taking out all that aggression at home, right? I mean, at school, the school is seeing it. You're seeing a well behaved child at home, but they're so angry and frustrated that they're expressing as bad behavior at school. That happens too. So, and I'm sure in school we have counselors who will come in and find out what's happening in the home and school to try to help the child as a whole, right? Sometimes you have districts that are not doing that at all. So we have to really pay attention to our kids. But again, it's still an educational approach. The district can only provide services. They're not a medical institute. They're going to provide services to help our kids educationally. We're going to do all we can do to promote positive education. With a medical need, it's different. So medically, they call it applied behavior therapy. In school, we call it BIS, behavior intervention services. See, even the name is different. It's still the same approach, but because it's two different perspectives, we have to label it differently. Medically, we're looking at the symptoms of the diagnosis, right? We're really really get into the symptoms of the diagnosis. What is happening on this spectrum of autism? What does the ADHD and the autism look like together? And we're developing a plan to target those functions of that behavior. And that's why it's considered like the medical approach. Our targets are going to be, you know, we're collecting data based off those medical targets. Whereas in a behavior plan, we're collecting data off of the behavior that's impeding on the ability to learn, the educational targets. That's what we see in the IEP, all educational approaches. But they do kind of go hand in hand. In some instances, in my opinion, they're the same. It's just a different approach because of how we're building. But at the end of the day, it's still life skills. How are we communicating? If my child is not responding to, and this is some more severe, cannot respond to an initial greeting. They can't look you in the face when they're speaking. They can't maintain behavior among an array of different staff, only with people that they're comfortable with. Now we're borderline social skills, right? And all of those things are going to affect their life outside of the classroom. And that is what we as parents and educators should really be looking at, the whole picture.
Yeah, well, that's good. And so Ness Care, I'm sorry, you have two organizations. One is a nonprofit and the other one is a for-profit.
Yes.
So do you provide either one? I'm just saying, like, is it more one? When I say one-on-one, I meant like one family on one consultant, or how does that work? What does that work or look like?
With Ness Behavior, it is very personable. So if you were to come to us and you were to request services for your child, we would work with you and the child in your home. So it's one clinician to a client. There has been very rare occasions. Yeah, go ahead.
So the in-home, that child is on home instruction, or they're just this is not in school, this is not preschool age, right?
Yeah, it could be any age. So we go all the way up to 21.
Okay.
Yeah. So when you're coming in to us for in-home services, we're working with the child in home, typically after school, one-on-one with the child, and then parent training. We always offer parent training for the parent. But there have been some cases where a parent will come to us through insurance, but also request services in the school. This opens a conversation for us to have that conversation with their district, wherever they may be. Most of the times the district will, push back, especially Department of Education. They like to push back. But it starts to allow the parent to start having those conversations. It opens the door for that conversation. And when they don't push back, we can start talking about behavior intervention services, the educational approach for in school. Allow if they find a need and we can objectively have data to present that the child needs a one-to-one, we can start having that conversation and have a one-to-one services in the school setting as well, if it's in the best interest of the child and there's data to show that it's needed.
Yeah, I like that. Now, is there a way, because I'm just thinking about the many people that need to hear about, just in general, just maybe having the conversation, just knowing the questions to ask, just, so do you have, like, if a parent has a child that may be like in the beginning stages where they're getting the phone calls and they're trying to set up that initial meeting or whatever the case may be, do you have maybe 3 questions that someone, a parent would want to make sure that they ask in one of those meetings?
In the beginning stages?
Yeah, like, so maybe the initial CSC or like,
Well, one thing that I do want to say is, in my experience in those CSC meetings, the district is reading the 504 plan or the IEP, right? And you're going through it from beginning to end. When you are going through that plan and the chairman is asking you, are you in agreement? Make sure you're in agreement, because you're verbally consenting. These meetings are recorded and you're verbally consenting that you are okay with those services. So I would always, one thing that I would give a parent is be prepared for those meetings. Make sure you have a copy of the IEP, number one. Make sure you know who is coming to the meeting. So a lot of times in those CSC meetings, it's your chair and it's everyone who has a hands on the support. That could be your physical therapist, your speech therapist, Do you know the goals that your child is learning when they're with the PT or the speech? Ask for that data. Ask for verbal feedback. What's the progress from the last time we spoke? Really good districts that I know, we work with some really good districts, they already have that prepared. And they hold us accountable. But there are some districts that if they know, like this parent, this family doesn't really ask a lot of questions, or they know that your concerns are not in the right place, a lot of things are going to go over your head, and you're not going to realize the lack of services that you have, or the lack of support that you haven't gotten until it's too late, right? But realistically, you were in those meetings and you okayed these plans. So I would always tell parents to be prepared, read the report, and come with questions. And those questions should be in response to that individual plan of what you're consenting to in the child's IEP, or feedback. If you haven't even reached the IEP stage, just the feedback from the teachers, what's happening in the day to day, to present what your needs and why you need them.
Yeah, no, it's very important. That's very important too, because sometimes, like you said, some people just don't. And then there's all the, like for me, I would be like, what does that mean? CSC, BI, BIP, all those little, I mean, obviously we know, right? But if I'm somewhere and they use like abbreviations and stuff, it's okay. You don't have to pretend like you know. Like, it's okay. What does that stand for, please?
Right.
And can you just speak in layman's terms? Like when I go to the doctor, don't talk to me about all of that other stuff. Talk to me and tell me what that really is, right? Because that would help. Because
a behavior plan, a BIP, yes. And the BIP is a behavior intervention plan. And the BIP should always come after the FBA, which is a functional behavior assessment. So what the FBA does is it identifies the behavior. So if you're telling me that my child is aggressive, right? And that's an intense word. That's an intense word, but we find these labels, right? Are general labels that we apply. And my child could be aggressive, her child could be aggressive, but they're defined differently. But that's intense for you to tell me that my child is aggressive. I don't want to hear that.
Right.
So the FBA outlines that. What are these behaviors that are happening? Be privy to that. Ask those questions. How many times did they engage in elopement when they ran away from class? How many temper tantrums did they have, and why did they have them? So if they're only having temper tantrums in lunch, mom should ask, well, what does the lunch cafeteria look like? Who's walking them to the cafeteria? Are they communicating with my child correctly? Get down to the nitty gritty, because yes, those targets are going to follow the child. If we have these targets this year and they've been maintained this year, they can't just vanish next year. What happened? So that's it. Being actively involved in every step of the way is important, so you don't miss anything and you hold people accountable.
Very good. Very good. No, this was good. And this was necessary. I think, and my question actually just came to me. It's like when you said like the parents and how they're, dealing with this, and that they need to be like on the same page, and they have to, have those hard conversations, and really, I think it's important for these parent trainings. I think I know some districts do where they have like a meeting, and all the parents can come, and then they talk about certain things. And I think that's important. Even, a lot of parents don't show up.
Yeah.
There are a lot that do, but I think that the conversation must keep going. So I appreciate this talk. I think that even we spoke more about the kids, but we're parents, right? We're moms, and we have kids, and the kids have different needs, and some are more than others, and so it's important to just know and just advocate for your kid, right? And not be in denial about what they may need, regardless of how small or minor or extreme, right? So
yeah. And just to piggyback on the parent training, us as educators and consultants have to be sensitive about our approach and how we're parent training. Like, parents are not coming because they don't want to be spoken to. Parents are not coming because this lecture that you're giving me may not be helping me when I have to deal with severe behavior at home. Like, how does this talk help me? And that's why the individualized parent training I love so much, because we really get hands-on with the parent. What are you going to do the next time this child elopes or runs away or attempts to fight you. Those are more severe behaviors. But in the moment, parent really having that hands-on support, just like we do with the child, right? Parents need that too, because we can read something, and then when I'm in the moment of it, all of what you told me to do is going to go out the window if you don't really get into the nitty-gritty of how I'm going to execute this program. And so those type of parent trainings where they're one-on-one with the family, that's what they should be looking like.
And one-on-one also makes it tailored to the specific needs, as opposed to some tips and tricks or whatever. I mean, it's good because it raises that awareness that they may not be thinking about, but it's very surface. So when you get to the one-on-one, that's good. That's good. So I'm gonna put up your website for those that want to check you out. If you have any further questions or anything, you can reach nesscares.org, and also follow on Instagram. Right? Because and where I'm sorry, and on Facebook it's the same name on Facebook.
Yeah, so it's Desirie with a hyphen, but what my personal pages will lead you to my business page. So if you just Google Ness Cares or Ness Behavior Consulting, you can find us that way too. Nesscares.org. We have one website for both entities, so it's going to take you to the homepage, and you can get all the information about Ness Cares, the nonprofit, and Ness Behavior Consulting, our for-profit, where we have these behavioral health services. So it's a lot of information on that website and a lot of resources.
Yeah, I was on there and I was like, oh, this is good. I got to dig a little deeper, but for sure. So thank you for that. I appreciate it. And don't forget, follow. So this part of the show is where we are going to play a quick game.
Okay.
This is called the This or That segment.
Okay.
So I'm going to say two things, and you're going to say the first one that resonates and comes to mind. Okay.
Okay.
All right. Heels or flats?
Heels.
Wine or cocktails?
Wine.
Beach or ski resort?
Beach. Girl.
Listen, I'm West Indian. Lazy river or roller coaster?
Lazy river. I'll do the lazy river.
Panties or thong?
Thongs, honey.
Read a book or watch a movie?
Watch a movie.
Makeup or fresh face?
Makeup. I like makeup. It's fun.
Yeah. Coffee or tea?
Tea. I'm a tea girl.
Dark skin or light skin men?
Chocolate. Sometimes in the middle.
I should make it 3, right?
Yeah, sometimes in the middle, because you never know.
Right. Pizza or burger?
Pizza.
Skirt or pants?
Skirt.
Okay. Morning person. Yeah.
Oh,
there you go. Morning person or late nighter?
Late nighter for sure. I gotta force myself in the morning.
Yeah.
It's a dog.
Dogs or cats?
Dogs for sure. I hate cats.
Okay. And this one's a 3-part. Do you have a dog now?
No, but maybe I'll get one.
Yeah.
It depends.
That's funny. This one is 3, okay? Chef, housekeeper, or chauffeur?
I'm gonna have to go with chef because I don't like to cook all the time and I love to eat.
Yeah, right. That's good. That's good.
For real.
That was fun.
I enjoyed that.
Yes. So no, this was great. I really think that this is so important. This conversation has to keep going. So maybe we can do something live or something on social media, just talking about it a little bit more. I think again, the conversation must continue, and then we could talk, about mental health. I know mental health awareness is coming up. Was that March?
Yeah. I'm actually putting together a March summit, so maybe we can talk again that time when that continues to unfold. Mental health summit. So we're going to be talking about special education and mental health, and we're going to have this conversation and really dig deep with the panel and the audience, and really have some resources to share. So.
Oh, nice. Okay, so now at the end of the episode, this is
Mhm.
what at the end we always leave with one like food for thought, mantra, affirmation, mindset declaration, anything that that you use to get you through the day or something that, because we write them down, we repeat them. We have a book full. This is like 80 something episodes. So we like to end each episode with some type of declaration. So do you have one for us?
Well, make time for yourself. Truly. And when you're having a bad day, just take a breath and appreciate what you've done thus far, right? So if the day is not going as structured as you would like it, it's still going. There's still a lot of things that you've overcome. Just getting up and saying okay or yes to anything that day, making those decisions. Give yourself some grace and always be kind to others, because you don't know what somebody else is going through or what they're holding together to be at that point either. So giving yourself grace and giving others grace is a big one.
So true. I love that. Give yourself grace and give others grace, because that is very true. And and sometimes the people may not be having a good day, but it's not personal, right? And so just not meeting people sometimes with their tit for tat or frustration with an attitude. Sometimes you can even soften them up by saying you have a great day or giving them a smile or something like that. So yeah, I love that. All right. Well, thank you so much, Desiree. Again, don't forget to go to nesscares.org for more information about all things we talked about today. So as we end, I want to say that I love you. I want you to be well. Be blessed and know that your past does not dictate your future. Till next time.